Well, hey guys. So as promised today, I'm going to go over all of your questions about microneedling and derma rolling the skin. You all seem to enjoy all of my kind of cosmetic procedure talks so far, with the talk about microdermabrasion, chemical peels, the talk on lasers, and the talk on extraction. So as I promised today, I'd be talking about microneedling, what it can be useful for, what you should know about it, and what to expect with it. And if you're new here, welcome. My name is Andrea. I'm a dermatologist who loves drinking coffee out of a Biggie mug or a Totoro mug. I film day in the life vlogs, which are fun, as well as a lot of skincare Q&A type content and skincare product reviews. So if that type of content is of interest to you, then stick around and subscribe for all of the fun. So microneedling is actually a fairly relatively new procedure in dermatology and plastic surgery, cosmetic surgery. In 1994, dermatologists and plastic surgeons first started developing the technique of something called subcision, or they basically would take a hypodermic needle and create a little bit of a wound within an acne scar. And what this can do is kind of help the scar, the skin underneath the scar, the dermis, start to generate new collagen and fill in the scar. Okay, and subsequently that led to interest in kind of developing these microneedling devices that would allow elegantly adjustment of different depths of penetration depending on the area of skin on the face being treated. However, it is a fairly new technique, okay? 1994 was not that long ago, and it's not, you know, it's been increasing in popularity recently, I would say. So we just don't have a lot of long-term data on microneedling and skin health. We don't have all of the long-term follow-up for all of these procedures that we would like, all of the long-term data and consequences and kind of, well, how long does this work type information. But in general, microneedling, also called collagen induction therapy, it does something wherein it's basically a device that rolls little tiny microneedles along the skin and allows them to, they penetrate the skin, create a little channel of a wound, okay, into the dermis. And what this does is it stimulates wounding and the process of wound healing, which can generate growth factors in the skin, collagen induction, that's why it's called collagen induction therapy, as well as new blood vessels coming in to help repair the skin and heal the skin, okay? And so you can imagine why it would be something that would be of interest and pursued for scars and for acne scars. And another reason why microneedling is of interest is that in creating these little holes or channels in the skin can potentially also allow more efficacious delivery of topical ingredients, okay? Like antioxidants, for example. I've talked at length about the limitation of putting antioxidants on your skin in a serum or cream, and that the skin barrier is just that. It's a barrier, okay? So antioxidants actually getting in the skin is very unlikely, and we have data to suggest that. And likewise, they're not super stable, but perhaps in theory, you know, delivering them through these little channels to deeper layers of the skin could enhance their efficacy. So there's a lot of interest in that, okay? But there are some shortcomings and some limitations to that, which I will discuss. But microneedling can be helpful. We have data to show that microneedling can help with the scars of acne as well as stretch marks on the body, okay? Stretch marks are something that are the result of, you know, thinning in the deeper layers of the skin or atrophy. All right, so they're kind of like a scar, but a little bit different, okay? But the principles are the same, that creams don't really get at that problem. You really need a procedure. How good is microneedling at improving a scar? Well, it depends on the protocol that the practitioner uses. A series of 3 to 5 treatments spread out over 2 to 4 week intervals can result in anywhere from 50 to 80% improvement in the appearance of acne scars on the face. Non-acne scars likewise can improve with microneedling. I can't really comment as to the percent improvement. There's just not that much data. And likewise, stretch marks can improve with microneedling procedures, but again, the extent that you might expect is difficult for me to say for sure since it's not as mainstream. And another popular use of microneedling is in skin rejuvenation and improving the appearance of wrinkles and fine lines, which also originate in the deeper layers of our skin as a result of a long-term cumulative sun exposure and just chronological age-related changes. So far, the optimum treatment protocol seems to be a series of 3 to 6 treatments, either bi-weekly or monthly, to get optimal improvement in wrinkles and fine lines. Another condition that is incredibly frustrating to deal with, and I have some videos on it, is melasma. And melasma is a condition, of dark patches on the face, in that it can target some of the deeper layers of the skin where the pigment lies that are harder to get at with topical creams that kind of exfoliate the skin, as well as they can help, the microneedling could potentially help to deliver some of the active depigmenting ingredients that I've talked about in some of my other videos, like tranexamic acid, for example, or vitamin C. Could also potentially be delivered that way. There's one randomized controlled trial of about 60 patients with melasma that demonstrated that application of tranexamic acid alone resulted in about a 38% improvement in an objective scoring rubric for melasma called MASI, M-A-S-I, which stands for Melasma Severity Index. However, the other arm of the study was looking at the combination of tranexamic acid along with microneedling. So the microneedling was performed and then the tranexamic acid was applied. And that group showed about a 44% improvement in comparison to the group that just did tranexamic acid alone. And it's also been shown in small case studies on 1 or 2 patients to be effective for dark spots on the face related to some other conditions as well. Non-melasma discoloration on the face. So, it's something that people try and seems to, in very, very small case studies, seems to be helpful. One condition in which microneedling has also been investigated in is male pattern hair loss or androgenetic alopecia. I have a video on this topic if you're interested in it, just kind of a Q&A on male pattern hair loss. But one study that was fairly large showed that what they looked at was application of they looked at microneedling and male pattern hair loss or androgenetic alopecia and subsequent application of minoxidil or Rogaine, okay? That was one group of subjects got that, and the other group of subjects just got twice-a-day minoxidil or Rogaine. And if you're like, what is minoxidil, what is Rogaine? I have a video on that as well, but that's sort of a standard treatment for male pattern or androgenetic alopecia. But what this study showed is that after 12 weeks of after the microneedling and minoxidil application, those people who got minoxidil and microneedling had an 80% better improvement in growth in comparison to those who just got the twice-a-day minoxidil. So, it was really, kind of suggested that perhaps this enhanced delivery of the minoxidil to those areas of the hair follicle. The other reason it's of interest is that, as I mentioned, it's creating little wounds, and those little wounds kind of help bring in some growth factors to heal the skin, and that's thought maybe to promote hair growth in those areas and within those hair follicles. As far as what to expect with the procedure, the area of the skin should be really, really thoroughly cleansed before this is pursued so as to avoid introducing makeup particles or bacteria or any pathogens into the deeper layer of the skin, because essentially you're creating a wound in the skin and there's a potential for an infection, okay? So first the skin is cleansed, then a little numbing medicine is often applied so you don't actually feel the needles going over the skin. A hyaluronic acid gel will often be applied to the face before using the device so as to facilitate its being able to move over the skin smoothly and not kind of get caught up. And really what the clinician is looking for is an endpoint of pinpoint bleeding, and that's kind of when they stop. That's what they're looking for. And then apply a cool ice pack to the area. And so for the first 4 hours after the procedure, it's a good idea to put the hyaluronic acid serum on to allow the skin to kind of recover a little bit. And then after 4 hours, sometimes a 1% hydrocortisone cream will be given to combat some of the excessive inflammation and irritation. And that's really only used for approximately 2 to 3 days. That's really only used about 2 to 3 days after the procedure. And then it's really imperative that you use a non-chemical sunscreen, so a mineral sunscreen, at least during the first week after the procedure. And it's advised that for the first 2 weeks after the procedure that you avoid wearing any makeup whatsoever, okay? Because there's a wound in your face. Makeup is just artificial particles, metals, you know, compounds, so you don't want to be injecting makeup into your face, okay? So it's advised to avoid makeup for 2 weeks after the procedure. Sometimes a single microneedling session is effective depending on the condition. Again, like I said, the long-term data, it's just not large enough to really generalize. But oftentimes bi-weekly or monthly repeat sessions are needed for, you know, anywhere from up to 6 treatments. The little bit of pinpoint bleeding, that is the endpoint that the clinician is looking for, that really resolves within a few minutes, particularly with the ice application. And then, you know, you can expect to be a little red, a little puffy, irritated. The skin will peel a little bit, and that usually resolves within about 48 to 72 hours after microneedling. A feared complication for a long time has always been that when microneedling is done on somebody who is of a darker skin tone or more ethnic skin, that tends to heal from inflammation with dark discoloration, that microneedling, which creates a wound and inflammation in the skin, can put you at risk for post-inflammatory hyperpigmentation. Some more recent studies suggest that that's not necessarily as risky as maybe we once were thinking, but, you know, again, there's just not a ton of data to say for sure. So there is still a small, you know, theoretical concern and risk for increasing your chances of post-inflammatory hyperpigmentation. You know, you are creating a wound in the face, so it predisposes you to skin infections during the procedure and shortly thereafter for sure. So the hygienic practices and the sterility of the instrument are paramount. That's why you know, this should be done by somebody who knows what they're doing in a controlled office setting, so as to not put you at risk for a skin infection. The other risk that has been reported more recently, now that you know, we have a little bit slightly more long-term outcome data, that really scares me quite a bit actually, is the fact that, you know, obviously there's interest in applying topical things to the face immediately after microneedling to enhance their delivery. But it's been shown actually that people who got microneedling and then vitamin C serums applied immediately afterwards, this is just the examples that have been published in the literature, got vitamin C serums directly afterwards, that later on they developed something called a foreign body granuloma, which is not anything anyone wants, okay? That is definitely an unwanted side effect. And specifically, it was determined objectively that it was in fact the vitamin C serum constituents that they developed a adverse reaction to within the body. And by foreign body reaction, foreign body granuloma, I mean when there is something foreign introduced into the skin, that can be something as foreign as a splinter, injected material. The immune system goes, whoa, wait, what the heck is this? And tries to wall it off, okay? And in doing so, it walls it off and it creates this kind of little shell of inflammation, fibrotic tissue around it. Depending on where in the skin it is and the extent and robustness of the inflammation, really what that ends up resulting in to your eye are visible changes on the skin like thickening, discoloration, a rash, and that is unfortunately more or less permanent, okay? So that is a permanent adverse effect that could occur with applying stuff to your face immediately after microneedling, okay? So it's one now that, you know, causes many clinicians to exercise pause with concomitant use of topicals, okay? Didn't appear in any of the Rogaine studies that people develop foreign body granulomas to components of the Rogaine in the hair studies. None of the other studies, you know, with the tranexamic acid, for example, in the melasma patients, has that yet been reported? But, you know, I say yet because it's still a relatively new area in dermatology, okay? So what should you know, okay? First and foremost, as I said, this is creating a wound in the skin. So I do not advocate anyone doing this at home with an at-home derma roller, an at-home microneedling device. I think you're putting yourself at a major risk in creating a wound on the skin that can, you know, predispose you to infection. And you know, you can't control the sterility of your device to the same manner, you know, as in a kind of a surgical, more controlled setting of an office. And, you know, likewise, exercise caution and be very, very aware of the fact that applying things to your face can, you know, then introduce them into the deeper layers of the skin and put you at risk for this adverse outcome. So I really, really caution people against doing this at home and buying those devices at home. You know, they're all over the internet. And I say walk away from those. You know, they're risky, actually. And we do see cases of skin infections from at-home microneedling and derma rolling devices. So, you know, be aware of that. Be careful, and don't be fooled into thinking that it's safe and minimally invasive and completely, you know, without harm to you. So be aware of that. The other people who should not go after this are people with active inflammatory lesions of acne, because it's creating a wound and inflammation in the skin, and you know, the inflammation is going to drive further acne that's going to create more scarring. So the acne has to be treated and no longer active before you go chasing microneedling, it would seem. You know, for scars, okay? That's really where microneedling would then come in. So no active acne lesions really is thought to be best. And then also, if you have a history of herpes cold sores or little outbreaks on the face, you definitely want to avoid microneedling during an outbreak, okay? Or, you know, a clinician would not perform it in that case. Thirdly, you should not pursue this if you have had recent sun exposure in the past few weeks. You know, and by sun exposure, I mean you have been out at the beach. Maybe you got a little bit of sun, you got a little bit of pink, maybe you got a tan, whatever. You don't want to go doing microneedling that week, okay? Because really you have just insulted your skin and it is damaged from the sun. The tan is a damage response. The burn is a damage response. So the last thing you want to do is go poking holes in the face. The wound healing thing, you know, that ship is not in port yet, okay? So you got to, your skin has to recover from the sun damage, from the sun exposure insult before you can pursue it, you know. So any significant sun exposure, sunburn, suntan within the prior, you know, 2 to 3 weeks, not a good time to be doing microneedling. Wait later down the road when the skin has recovered. But do be aware that it is still a fairly new technique, and you know, we don't know everything, so be aware of that. So I hope this video was helpful, and thank you guys so much for all your fantastic questions. You seem to be enjoying the talks on cosmetic procedures, and I hope to do some on Botox and fillers and all of these types of procedures in the near coming weeks here. So if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.